So when we have a patient who comes in for their initial complimentary consultation for body contouring, we do ask a multitude of questions. Initially, when they fill out their application, we have them kind of circle their areas of concern. There are certain devices that may be better for a certain body area, potentially a certain body type. If a person maybe has more skin laxity, they might be a better candidate for maybe a Morpheus or any other radiofrequency type procedure. If someone maybe has more fat remodeling, we may want to consider a deeper procedure that also includes liposuction. Everyone's pain tolerance is quite different. So some patients, even if they have to spend an hour a week here for 6 weeks, they would much prefer a treatment that's going to be very comfortable, that they can kind of hang out here and work during their treatment. And then we have other patients that kind of want just that one and done. They don't care if they have to wear a garment for 2 weeks or 6 weeks and maybe have limited activity for several days. It really is going to depend on patient preference and what works for their lifestyle. It is also dependent on seasons. So in the winter, we often will have patients maybe that don't mind more downtime, but in the summer, they're traveling and they're with their kids and they're out in the sun a lot. So there may be something that they could have more downtime, seasonally, but in the summer, we may start with something a little more non-invasive and then graduate to something more invasive. And I think that's another great point is, based off of our consultation, I will make recommendations and then also listen to the patient. We'll come up with a treatment plan together. Sometimes we do decide, well, let's start a little bit more non-invasive. And then if we don't get the exact results that we're expecting, then we can flip to something more invasive. For a lot of patients too, beauty budget may be a little more confining. So utilizing 2 treatments, that may not work for beauty budget. So we may, really need to get it right the first time and be very specific in the treatment option, or we may need to wait 6 months or 9 months until we can perform the treatment that will work for them. Some of our treatments offer more immediate results. Other treatments may take 3 to 6 months to see the result.